And we do continue our pandemic coverage now, and this Omicron wave colliding with holiday travel. Airline disruptions continue for a third day because of staffing shortages related to sick calls. And new tonight, the nation's top infectious disease expert signaling proof of vaccination could be a requirement for air travel in the future. The latest CDC data shows the number of Americans who were vaccinated last week rose just under 1%. So here are the latest COVID numbers. Cases up 1.5%, that is over the past week. Hospitalizations rose by 4%, and deaths are up 8%. More Americans are being tested for the virus, about 1.5 million per week. The 7-day average of new tests is actually up more than 7%. And while testing clinics are trying to keep up with the increased demand, if you have tried to get a test lately, you already know it is very hard to get one right now. Again, today, long lines stretching through streets in major cities all across the country. And NewsNation's Marky Martin joins us live from Dallas with the very latest on this. Marky.
Hey, Nicole. Yeah, no doubt there is confusion. There's impatience surrounding the testing. I'm actually joining you from home because I am one of those breakthrough cases. But yeah, people are juggling their options right now. Should I take the rapid test? Should I take the PCR test? And really, it depends what kind of time you have. But there are a lot of people who would be happy with either, if only they could find either in the first place.
As Omicron takes the lead as the dominant variant, it now accounts for 150,000 new cases a day.
It is extraordinarily contagious.
This morning, during a White House briefing, President Biden acknowledging that more needs to be done on the testing front after droves of Americans had difficulty finding tests over the Christmas holiday.
We went from no over-the-counter tests in January to 46 million in October, 100 million in November, and almost 200 million in December. But it's not enough.
Excuse me, ma'am. Let's move forward.
In cities across the country, people waiting in line for hours.
In my experience, there's a rush everywhere. I've seen lines wrapped around the block.
Hoping for quick answers and a negative test before heading home to family.
I'm getting on a flight to Tampa tomorrow and just wanted to make sure everything was okay for the trip.
Come January, the White House will provide Americans with access to 500 million rapid home tests, which health experts call an extra tool in the COVID toolbox.
If you have an at-home test and you have a positive, these are pretty specific tests, and right now with high transmission rates, I would say you should isolate.
But officials warn that rapid tests aren't as sensitive or accurate as their viral counterpart, the PCR test.
If you have symptoms and you have a negative rapid test, I would not trust that. It's estimated that about 1 in 5 will give you a false negative.
The PCR test remaining the gold standard for diagnosing, correctly detecting COVID more than 97% of the time. According to the CDC, consider using a self-test when you need quick results before joining indoor gatherings with others outside your household. A negative home test means the rapid test did not detect the virus, but it doesn't completely rule out infection. Repeating the test within a few days with at least 24 hours between tests will increase confidence you're healthy. And while the government gets ready to crank out 500 million tests, their plea remains constant. Vaccination is key.
It is clear that everyone has the ability to make a choice to save their lives.
And Nicole, the U.S. Surgeon General estimating that because of vaccination efforts we've seen so far, he thinks that has saved about 1 million U.S. lives. And back to these government tests that are coming January, that's going to be a really big deal for folks because up until this point or up until January, people are shelling out $15 to $40 a pop just to take home those rapid home kits. Nicole.
Yeah, Marky, you're absolutely right. You mentioned, you yourself have COVID. You got that positive test back on Christmas Eve. Tell us, what have your symptoms been like?
It made for a very interesting and distanced Christmas. I think that was the hardest part, just not hugging my family this weekend. But overall, my case has been pretty manageable. That first 24 hours was the worst, a terrible headache. I don't get migraines, but that is about as close to a migraine as I could imagine. Sore throat, a cough that is still lingering. And honestly, the fatigue has been the worst part. I'm sleeping 10 hours a night and I'm ready for a nap by noon, which is so unlike me. But I do feel very lucky that the case that I got came after the vaccinations and after my booster shot. Nichole.
Yeah, well, we certainly appreciate, your candidness with us. I want to tell you, you look fabulous. I know that you live in Dallas. What's the experience been like there finding tests?
Thank you, Nichole. I don't feel fabulous today, so I'll take it. Lines here in Dallas, they are long. There's a testing clinic just a few blocks down the road here from me, and there are cars for 3 blocks today. But my experience, I got actually COVID from my husband, who brought it home from a work trip to New York. And my in-laws, thankfully, had their hands on a few at-home tests. And my mother-in-law just texted me. She said, I went to 3 CVS's. 1 was out of stock. 1 let me buy 2. And then the last one she went to said, take as many as you want. So it really is kind of the Wild West of finding these at-home tests. I got a PCR test done today, but even those, whether you do it at a CVS or a Walgreens, it'll take a few days before you even find an open slot. The next one I can take is on Thursday. And I still haven't gotten my PCR test results from yesterday, which should take about 24 hours, but that's how overwhelmed the system is. Something that should take, 1 turnaround day is now taking 3 to 5 business days for some folks.
Yeah,
Nichole.
we're certainly seeing this. Marky, we want to wish you and your husband all the best. Hopefully you both feel better soon.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.